Welcome back. My name is Dr. Kyle Richmond, owner of Rebuilt Strength and Rehab here in New Lenox, Illinois. I'm a chiropractor, but I treat more like a PT, heavily versed in more of the active population, athletes, gym goers, everything in between. I mean, I see people who even work at desks, but people who want to have an active part in their care is my specialty. So it's not just soft tissue work, adjustments, send you home. There has to be some sort of active component. Hence why we are talking about pain today. And the big thing when it comes to pain is how much your mind and your brain plays a role into that. So let's start with just a few basic things right now. We have two main paths of our nervous system. So we have our parasympathetic and we have our sympathetic nervous system. Our parasympathetic is our rest and digest. So when we are relaxed, when we're sleeping, when we should not be stressed, that's the nervous system that's going. That keeps all of our organs functioning, it keeps us alive and happy. Then we have our sympathetic nervous system, which is our fight or flight. That's our go. That is where, unfortunately, most people spend way too much time in their life with, from work to stressing about their day, stressing about life, issues at home, issues at work. We spend way too much time in sympathetic and not enough time in parasympathetic. Now, both of these will influence our pain levels. If we have too much of the sympathetic, our pain levels are going to be a lot easier to hit. If we're finally getting into parasympathetic, our pain levels can reduce a lot quicker. That's why it's so important to, one, pick out your triggers for pain, and I'll talk about that in a minute, but a lot of people don't know what their triggers are. They have zero idea. They don't realize what's causing their pain. They just think, pain equals damaged tissue, and what we know is that's not the case. Pain, or a famous saying is, hurt does not always equal harm. Just because your elbow hurts or your back hurts doesn't mean tissues are damaged. They're sensitive. So let's go into a little bit of what that means. Pain and touch, or not proprioception, but like physical touch, all run through the same channel of information to your brain. So if you hit your funny bone, people hit their elbow, they immediately start to rub it because it makes it feel better. That pain signal you're feeling and the touch run through the same channel, so you can block that pain signal temporarily. That's why we use things like heat and ice and massage and cupping and kneeling. All that stuff feels really good, but temporarily blocks your pain signals. Even stretching, people say, hey, I stretch and everything feels great, but then my pain comes back. Because you're doing temporary, like, short fixes to the nervous system, you're not actually changing the cause of that pain. Now, pain science gets super complex. I mean, there's multiple books. I don't know if I have it here, but one book called World of Hurt by Annie O'Connor is phenomenal. It gets super in depth when we talk about all the different pathways to the brain, but what I need you to know is, what is my cause, what is my trigger, and then how do I manage that? The three top ways I help people manage pain, obviously there's the physical touch of all the therapies I just listed, soft tissue work, massage, adjustments, you name it. You can also self-manage with breathing techniques. I don't know if anyone knows what like diaphragmatic breathing is, meditation, yoga. A lot of those are going to help de-escalate us and bring us from sympathetic nervous system and back up to our parasympathetic nervous system. And your third one's movement, or finding some sort of activity that you enjoy. Now, there's a fine line between that. If we're doing activities like, let's say we like to watch a show that's super intense, well, that's gonna kind of elevate our heart rate and get us into a sympathetic mindset. We gotta find something that's more parasympathetic. A lot of my high school, college athletes, or even people in their 30s and 40s like to play video games as a way to wind down, but some of these video games are stimulating their nervous system to the point where their heart rate's elevated the whole time, and that keeps you in that sympathetic mindset. So we have to find things like, some people enjoy reading more, some people enjoy just walking at night, helps bring them back down to the parasympathetic state. So with that information in mind, let's go through and answer a couple of these questions you guys submitted. So first one out of the gate here is, why does being in pain make me so irritable? The pain isn't even that bad sometimes, but I don't even notice it until I snap. So pain can make you irritable because think about, we have like a bucket we're constantly filling with water. Every little bit of stress keeps dropping more water in there, more water in there, more water, more water, and to the point where that bucket's full, and then we just explode. That's what your nervous system does. It's constantly being triggered just a little bit, enough to, like, that stress adds up. No one just snaps after one little bit of stress. Like, someone cuts you off in traffic, okay, but then someone else cuts you off in traffic, and then you get a bad phone call, and then you get home and your significant other's mad at you, and then all that stuff builds, stress in the nervous system until you absolutely go. And what we know is, the more stress we have, the more we're in the sympathetic part of our nervous system, that increases our pain signal. So our pain is heightened just beyond belief at that point. So to answer that question, pain makes you irritable because your body's stressed. Your mind's stressed. There's just stress coming from so many different directions that we don't know what to do with it. And I think too, when you go and talk to a clinician, so chiropractor, PT, whoever, massage therapist, half the battle is talking to somebody and understanding where they're coming from. A story I like to tell is this happened to me in my clinical rotation in grad school. It was a 40-year-old male, had back pain, on and off. But what he realized is he always had his back pain when he went to his mother-in-law's house. His back pain was always the worst because he was in the most stressed environment for himself. He didn't get along with her. They had some arguments and fights, but every time he went there, his back was in pain. Didn't change anything else. Go home, relax, wake up next day, back's totally fine. But it was always that one trigger. So our environment can also influence our pain signals. So let's go to the next one. I've been way more anxious lately. I'm starting to wonder if it's the pain. Again, so increase in pain increases our sympathetic nervous system. The more pain we have, the more our sympathetic nervous system is going into that fight or flight. So our heart rate's elevated, respiration's elevated. We become more anxious. You're not anxious when you're sitting there breathing, relaxing, doing yoga and meditation. You're anxious when you're driving to work. You're anxious when you're maybe at work. You're anxious when you're out and about at a social event, because we have more things increasing all of our respiration, heart rate, you name it, blood pressure. So your environment influences that a lot. You'll notice like some people like to be home more than they like going out because they feel more anxious when they're out, because we're in more of a sympathetic mindset. Hence why people then gravitate more towards alcohol, any vaping, smoking, whatever it is, because that's going to de-escalate your nervous system, and that can also make you feel better. That's why people go to painkillers right away. Immediately brings you down. My feet hurt constantly, and now I can't focus on anything. So when we have a lot of pain, sometimes it's all we can focus on. Even if the pain's not that big, it's where your mind goes, because it's the one thing that's always going up to your nervous system directly. Pain always takes priority over any other sensation, most often. Something like that I'd suggest is finding that relaxation exercise for you, and I say exercise or hobby, whatever it might be, whether it's reading, walking, hanging out with friends, some sort of TV show you enjoy, and at the same time, do some mobilizations with your feet. Massage it, ice it, pair those up together and focus on, if you guys have ever heard of box breathing or diaphragmatic breathing, something of that nature, I highly recommend looking at that. But it's a 5 in, hold for 5, out for 5, hold for 5. Repeat that for a few minutes and watch your nervous system start to slowly come down. A lot of you have like Apple Watches. Highly suggest put the heart rate on there and watch your heart rate start to change as you do these activities. You might even notice like when you feel you're anxious, look at your heart rate and see, hey, am I in a sympathetic response or am I in a parasympathetic response? So to answer that, it's hard to focus on other things because pain's going to take priority, but we have to prioritize something else to get us out of that. Otherwise, you're just always going to worry about that one thing. Like when you stress about something that's going to happen 3 days from now, you can't do anything from now till that 3 days. You have to find something else to get your mind off that. Same thing with pain. That's why like in my clinic, I give people exercise to do at home, because that exercise is going to help temporarily block the pain signal, improve their function, and keep them feeling better between appointments versus not doing anything. Because now all they're focused on is that next appointment. Instead, now they have something to physically do. That's why mobility routines are so great, or stretching routines, because you have something you could actively do to help manage your pain as the day goes on. All right, we got 2 more here. Compression socks, good for daily wear or just recovery days? All depends on why you're wearing them and what you're doing. So for example, if you're on your feet all day or you've got like foot pain, you want to also make sure you have the right level of compression. So they usually recommend like 15 to 20 millimeters, no, not millimeters, mmHg, I forget what that means. Is usually where we shoot for. It's going to help reduce your inflammation, support your circulation, limit your swelling. If you're standing on your feet all day or up on your feet, if you have the ability to sit to stand, you probably don't need them. If you are getting a lot of swelling in your feet, you probably should go to the doctor and see what that causes. Sometimes it's dietary, sometimes it's stress, sometimes it's physical activity, problems with the venous system, returning blood. I would highly recommend on getting that assessed first. But in the same token, like a lot of people use compression for recovery, like the Normatec boots or I'll call them like the Compex machines, any sort of Firefly, something that returns blood back to the heart is always super great for recovery in general. Last one, I tried stretching before bed last night. It actually helped. Any good ones to keep it from getting boring? I recommend finding a good mobility routine. Something you constantly do differently, because what happens, we do the same thing over and over and over. Yes, routine's good, but if you're doing the same thing, at some point you're gonna get bored. It's like you can't watch the same TV show every single night, or the same episode. It's the same show, but you have a new episode over and over and over. I offer some mobility routines. I have free ones on my account. Vibit has, I know you get stuff when you purchase Vibit. There's an option to get some routines or exercise or demos. There's a ton of stuff online. I just recommend finding something that's simple enough you can stick with, because consistency is the real big key here, especially when we're talking about pain. You have to be consistent. If you're sporadic, you won't get the same relief. So stretching before bed, great. And then I would definitely try to switch things up every once in a while to keep things feeling good. So whether it means focusing one night on hips, one night on shoulders, one night on back, always moving that target can keep it fun and obviously engaging for you. Okay, we answered all the questions on our list. I don't know if anybody else has something in here. I'll give everybody a minute, but big take homes for everybody today would be, you need to determine which nervous system you are constantly sitting or constantly living in. Americans, as we know, have a very go lifestyle where we don't turn off. Being on your phone, being on TikTok, Instagram, Facebook, that's stressful to your body. You notice that's a lot different to your nervous system than it is just reading a book or sitting there and just staring out the window. It's very hard for us to do because it's a very boring activity. People don't get themselves heightened up enough, so they look for that dopamine response. And pain's influenced by that. If you're always in sympathetic, it's like that bucket analogy. If you keep putting water in the bucket over and over and over and over and over, eventually it overflows. Eventually something gives. You'd be very surprised at the amount of people that I treat that have pain, that pain reduces by just breathing and talking and light movement. Even though we thought something was damaged in there, pain does not always mean something's damaged. Because all of a sudden you woke up one day and you had pain. You didn't run through a brick wall, you didn't get tackled, you didn't fall, but now I have all this pain. What did I do? It's because you didn't damage anything. Yeah, Eric, TikTok does deregulate you. It's most often where people use it the most is first thing in the morning. Like they get out of bed, they're on their phone right away. Your brain's not already going. You're still not, like you've been in a parasympathetic ideal when you're sleeping, all of a sudden you spike to sympathetic, not this gradual rise. Or we do it at night. We're sitting in bed and we should be sleeping. We should be calming down, winding down. We're skyrocketing our sympathetic nervous system, and now we're falling asleep out of exhaustion, not because we should be sleepy and going to bed. And for any of you that track, like I use an Oura Ring, or some people use a Whoop to track their sleep, you want to have enough deep sleep. If you can't get a deep sleep, it's because you're too stimulated before that, and you have a hard time coming down. So a lot of people don't even get into the parasympathetic as much as they think they do. Your heart rate, resting heart rate matters, your blood pressure, your cholesterol, all that plays a role into all this, but your activities matter, your environment matters. Like you'll know when you're traveling, it's a lot harder to sleep and feel good because your whole routine's thrown off. You're in a more stressful environment, you gotta catch a flight, you gotta get a hotel, a car, whatever it might be. But when you have a day off at home and no one's bothering you, that's sometimes the best you've ever felt because your environment matters. That's about all I'm going to talk about today. I know it can get very in-depth. Pain is extremely complicated, but can be super easy once we figure out what our triggers are. It's not a one-size-fits-all. We have to determine, what nervous system state you're sitting in. If you got one thing out of this today, I would try just that box breathing I talked about, some sort of diaphragmatic breathing, get your nervous system calm. Do it for 5 minutes. I think a lot of people don't also realize too that these things I'm talking about, 2 minutes. If you just sat at your desk and for 2 minutes decided to, we never even take the chance to do that. We sigh because we're gasping for air since our body needs more oxygen, but take 2 minutes, do that. Tell me what the rest of your day feels like, or the rest of that hour feels like. Every hour, take a couple nice, slow, deep, controlled breaths and see what happens to your pain or just your overall feeling of your body. Because if you can constantly battle and not fill that bucket with water over and over and over, you're not going to overflow very often. You're not going to have these crazy spikes in pain. You're not going to have these issues. Now, I shouldn't say you're not going to have these issues. You're going to have way less. We're always going to have pain. Pain's a normal thing in life. Pain's our check engine light. It tells us something's going on in the body. If we didn't have pain, we'd have way bigger issues that we need to control. Some pain's normal, but to reduce that chronic, never-ending pain cycle, that constant loop you're having, you have to find ways to deregulate. So I'm going to leave you all on that. Thank you for those that come and watch these live, those that enjoy this afterwards. I appreciate you. If you have any additional questions off of this or have some more questions maybe for our next topic next week, please submit those, and we're going to keep rolling with these every week. So thank you guys, and we'll talk very soon.